how to control a high libido, plus unique ways to use CBD in the bedroom. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, a sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, our very own Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a therapist here to share how she helps couples get through infidelity. But first, let's take on some more viewer questions.
Dr. Leah, a man says, my wife has no problem having multiple orgasms. Lucky him. I will have mine, but it takes a while to get up the ability to do it again. Meanwhile, my wife is not close to being done. How can I shorten my refractory period? And by the way, what's typical refractory period and what exactly is a refractory period?
Well, so a refractory period is going to be the time it takes from a male to go from ejaculation to being erect again. And every refractory period is different. It can last between a few minutes to 24 hours, and it changes with age. And there are many factors that contribute to the length of a man's refractory period, including overall health, relationship quality, quality of sex, and frequency of sex.
All right, so here's the key question. What can they do to make it shorter?
Well, you could try some lifestyle changes to shorten yours, like doing cardiovascular exercises such as walking or running, definitely maintaining a healthy body weight, eating a healthy diet, and treating or managing any underlying medical conditions.
So if there's any kind of medical conditions, so do meds help or any research on that?
There is some research that found that certain erectile dysfunction drugs can help shorten a refractory period. One small trial found that 40% of male participants saw a large reduction in their refractory period when they used sildenafil.
A woman says, I have knee problems, but I want to do more than lay on my back when we have sex. What can I do to be more mobile?
You are not alone. About 1/3 of Americans have knee pain, and it can make having sex uncomfortable or painful. Assuming you do not have a knee injury, it may be helpful to move your knee through its normal range of motion because your body is releasing endorphins. Exercise regularly by strengthening your quads and hamstrings because these can help stabilize your knees. Also do squats, step-ups, and straight leg raises because they're great exercises for you. You may also want to have anti-inflammatories handy if you know you're going to have sex.
So anti-inflammatories are not going to affect sexual mood or anything like that, correct?
They shouldn't.
Okay, good. Well, I'm going to tap into your brain because that was a lot, but I'm going to ask you a little bit more. Any other tips for our viewers?
Well, before you plan on having sex, take a warm Epsom salt bath. This heat may help reduce your knee pain. It's also a great way to get you in the mood. Plus, once you get in the bedroom, you could use pillows to cushion your body and ease the stress on your knees. You could also put a pillow underneath your knees, back, or stomach to help you get into a more comfortable position.
Are there any positions that are better than others?
Although the missionary one is good for someone with a bad knee, you could also try spooning, where you and your partner lay side by side facing the same way. You want to stick to positions that don't put pressure on your knee and try to find ones where your legs are straight. After a day of using your knee, and you may be dealing with some pain, so having sex in the morning might be better, or earlier in the day might help, but you might also be more stiff, so listen to your body.
Dr. Leah, a man says, my wife and I love to watch porn of women squirting, and my wife wants to do it too. Is it real? I mean, I've heard that it's real, but is it real? Is that something that can be taught or something that every woman can do?
Well, squirting is real, but squirting in porn might not be. So if a female is really squirting, it's going to be like little spritz that are accompanying an orgasm typically, versus a strong stream, and a strong constant stream is usually not going to be squirting that you associate along with an orgasm. I actually saw an interview with a porn star, and she was talking about squirting, in fact, and she said that she had actually only squirted once despite being in actual squirting porn. And actually the time that she did wasn't being filmed, it was during a personal encounter. But she said that they actually filled her with water or had her drink a ton of water right before these porns. So I definitely think it's real, but just because you see it in porn doesn't mean that it is.
Okay, so for people who don't watch or don't know what that is, I mean, can you explain what is it exactly, Dr. Leah?
Squirting is an informal term used to describe when a female releases a specific type of fluid from the urethra in response to sexual stimulation. The liquid released during squirting is usually clear, odorless, and colorless. It sometimes comes out in relatively large quantities. To clarify, this is different than just getting really lubricated. Some women confuse the two. Female ejaculation can be used to describe the release of another fluid, which is typically in smaller amounts.
So can they happen at the same time?
Yeah, the fluid release of these two can happen independently of each other or at the same time. Unfortunately, the whole squirting thing is still a debated concept. Some insist that squirting is just urine, while others say it is a different fluid. Although there's no scientific consensus, pelvic ultrasound scans were performed after voluntary urination and during sexual arousal. All participants did show bladder emptiness and showed noticeable bladder filling just before the squirting. However, the prostate-specific antigen was not detected in the urine sample before squirting, but it was present in the squirt fluid as well as the squirting sample itself, indicating that the fluid is different than simply urine. Each person's experience with squirting is different. While some methods can make people squirt more than others, there's no one proven method that's going to make everyone squirt. This is because each vagina is different.
What is PSA exactly?
So prostate-specific antigen is what it stands for. And women have a glandular tissue below the bladder and surrounding the urethra that is similar to a male prostate. And women, they call it the Skene's glands, which create the PSA.
So what can a woman do to try this?
Well, you could try bearing down on your pelvic muscles when nearing an orgasm, or change the tilt of the pelvis, or strengthen your vaginal muscles through Kegel exercises. I would also suggest trying different sexual activities. Contrary to just porn, vaginal sex might not be the best way to squirt.
Still to come on Sex Talk. What happens in sex therapy? Recovering after infidelity. Treating painful erections.
Ever wonder exactly what happens in sex therapy? Here's a little insight.
Sex therapy is a valuable resource for individuals and couples seeking to address and overcome sexual concerns. Typically, therapists will have an initial assessment where they gather some history and discuss your concerns. A sex therapist may ask about your sexual history, medical history, and sexual habits. During sessions, a therapist can help clients work through developing skills, improving communication, or dealing with depending on pornography as a few examples. Clients can receive homework assignments designed to reinforce the skills and techniques acquired during therapy. Sex therapy is meant to provide a safe and supportive space for open dialogue, education, and the development of effective strategies to enhance sexual well-being. By addressing specific issues with a trained therapist, clients can achieve a more fulfilling sex life.
And take time to find a good therapist. Make sure they have the right credentials and look into their reviews. Coming up, dealing with hot flashes in the bedroom. Plus, how to discover your partner's turn-ons. That's next.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have relationship expert and owner of Buksani Counseling Care, Dr. Rachna Buksani Mirpuri. Thank you for being here.
Thank you.
So we're going to jump right in. How common are affairs and why do you think they happen?
They're more common than I would like. I think they happen for a couple of reasons. One is, of course, a dissatisfaction in the relationship, right? So I'm going to look outside when I'm not satisfied in the relationship, but also it could be a result of my past. So if I've had a traumatic past, sometimes that could result in me, seeking somebody outside of my relationship.
So we always hear once a cheater, always a cheater. What's your thoughts on that?
I don't think that's true. I have worked with several couples who have had incidences of infidelity, have come out of it, and really gone to be having very, very successful relationships. So I don't subscribe to that thought.
So when someone has been through that, when would you, not necessarily advise divorce, but when do couples really need to keep working, or when do they just kind of call it quits?
I don't think the infidelity is going to determine when a couple is going to call it quits, right? So to me, a couple needs to call it quits when really there's a communication breakdown. If I'm just not getting through to my partner and my partner's not getting through to me, that's when we think of, okay, maybe there's something to divorce or separation. But I think with infidelity, you can really work through it as long as the partner who has cheated understands that it's going to take a lot of effort on his or her part, a lot of patience to rebuild that trust in the partner who's the victim here.
So how can a couple overcome the infidelity?
I would definitely recommend getting into couples therapy, because that's kind of what we do. When a couple comes in and infidelity, they're coming in because of infidelity, we really help the couple work through those trust issues, because in a sense what's happened is you have broken down the house, right? So we talk about trust and commitment being the two pillars of our relationship house, and both of those are kind of broken or shaken. We need to rebuild that. So we really teach the partners how to do that. The partner who's cheated, how to be patient and rebuild that trust in the partner who's the victim, and also the partner who's the victim, to teach them forgiveness, right? Like, how do I move on from this? Because obviously it's a very hurtful experience for them.
So what are some techniques that you use to teach forgiveness?
See, here's the thing. I think forgiveness is a very personal concept, and I think, to me, what really worries people with forgiveness is they think that if I forgive a person, that means what they did was okay. That's not what forgiveness is, right? Forgiveness is, hey, what you did was not okay. It really hurt, but I don't want to hold on to that, because holding on to that is going to restrict me from having a normal and fulfilling present and future. So really, forgiveness is something I do for myself, right? I make peace with, okay, this happened. I also understand that, if the relationship, if my partner has looked out of the relationship, that means there's fundamental problems in the relationship that we both have to deal with. And if my partner chose to go outside of the relationship, that was maladaptive, but a coping mechanism. So if I can empathize and begin to understand and look at the situation in that way, I think that forgiveness comes easier.
So if somebody does suspect their partner of cheating, what would you suggest they do?
Communicate. Talk to your partner. If you suspect there's something going on, sit down and have a conversation with your partner, and talk about not only, hey, is something going on, but evaluate your relationship. Hey, how do you feel in the relationship, right? Where do you think we're at? What do you think we need to do to improve the relationship? So have those conversations to understand your partner better.
So I think that most people know going through your partner's phone without their permission is really not okay. How do you feel about if you were to say, hey, may I see what's going on in your phone, if you're suspecting something?
Of course, and I think that's completely fine. In fact, one of the things that we do, you talked about how we kind of help couples work through infidelity. That's really one of the techniques we have, because if there is infidelity in the relationship, the partner who's cheated has to kind of give access to everything to the partner who's the victim, right? Because how else are you going to rebuild that trust? So if you really have nothing to hide, does it make a difference if your partner wants to go through your phone? Right.
Absolutely, I agree. Right. Well, thank you. Great advice, and thank you for joining us.
Thank you. Thank you.
We'll be right back with more Sex Talk after this.
Still ahead on Sex Talk. Managing hot flashes. Bringing CBD into the bedroom. Treating painful erections. Can you have too much sex when pregnant? Taming a high libido. Discovering what turns your partner on.
Back here on Sex Talk, let's take some more questions from our viewers.
Dr. Leah, a woman says, my hot flashes have gotten the best of me and it is not sexy. What can I do so it doesn't get in the way of my sex life?
Well, about 80% of women experience hot flashes during menopause, which can certainly put a damper on your libido. For many, those hot flashes are intense and frequent, and some women have reported separate beds because their partner's extra body heat can actually trigger a hot flash while they're sleeping.
Okay, so I guess it also affects the mood, correct?
Yeah, separate beds is going to put a little damper in
Right.
that.
So how can you deal with, let's say, hot flashes to feel confident and sexy?
Well, I mean, first things first, lower the temperature in your bedroom. Also consider spraying yourself with a cooling mist. Consider that hot flashes are interrupting your sleep and making you fatigued, causing a negative impact on your libido. Try planning to have sex earlier in the day or taking a nap so you feel more rested at bedtime. Menopause can also include mood swings, which the hot flashes probably aren't helping.
Maybe also jump in the showers to cool off.
Cold shower.
cold
Although that
shower.
could damper the mood too.
Yeah, so not too cold, like lukewarm. Cooler than the hot flash. Can you get a treatment or a medicine for this?
Well, there are medical treatments for hot flashes like hormone therapy and antidepressants. Other prescription drugs have shown some promise at reducing hot flashes, including a couple of anti-seizure drugs, but they do have some side effects. So you always want to talk to your doctor about what's available and what's best for you.
Great. Moving on to our next question, Dr. Leah. A viewer says, we want to incorporate CBD into the bedroom, but don't know where to start. Any tips?
So CBD is the active ingredient in cannabis, and it comes in many forms like bath soaks, lubricants, and massage oils, and edibles, and it can increase pleasure during sex. So much so that even though Americans reportedly aren't having as much sex as they used to, people who use cannabis regularly are having more sex.
Is there any research on this, Dr. Leah?
Yeah, so Stanford did a huge study of 50,000 men and women and found that people surveyed who used cannabis weekly had about 22% more sex, and women actually reported having 34% more sex. This was across the board, regardless of marital status, race, or age.
Okay, so smoking a joint, having marijuana makes you have sex? Is that?
Well, actually, past research on human and rodent models have shown that marijuana use may increase arousal. However, studies have also shown that too much marijuana can decrease sperm count, and while men may want to have sex more, orgasm might be a challenge. So not to bore people with statistics, but I do teach a research methods and stats course at NSU. And so whenever you see a study of 50,000 people, you have to realize that it is in fact a correlational study, meaning they didn't give certain people marijuana and then test whether or not they had more sex. So they were just looking at people who are already marijuana smokers and examining their sex lives. So the reality is people that are more apt to try different drugs and try different things might already be the people that are more apt to have more sex.
Okay. So if they want to incorporate it in the bedroom, what should they do?
Well, if you want to incorporate CBD in the bedroom, make sure that you get the cannabis-derived CBD product, not the one that is derived from hemp. The cannabis has a higher THC content, which is the main psychoactive ingredient that causes that high. Just be aware that the CBD products are not FDA approved and could be inaccurately labeled.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
While sex is meant to be pleasurable, some people experience painful erections. Here are a few causes and treatments.
There are several causes of uncomfortable erections. Sometimes infections can cause pain. Sexually transmitted infections like gonorrhea, chlamydia, or herpes can cause inflammation and discomfort during sexual arousal. Timely diagnosis and treatment of the underlying infection are essential to alleviate pain and prevent further complications. Peyronie's disease is a condition characterized by the formation of fibrous scar tissue inside the penis, leading to curvature and pain during erections. The exact cause is not always clear, but it may result from trauma or inflammation. Treatment options for Peyronie's disease include medication, injections, and surgery to correct the curvature. Occasional discomfort or pain during erections is common, but persistent or severe pain in the genitals can be concerning and should not be ignored.
always make an appointment with your doctor or seek emergent care if you have any concerns. Let's take on some more questions.
Dr. Leah, a woman wants to know, how often should you have sex during pregnancy? Is it safe, Dr. Leah?
Yeah, I mean, unless your doctor told you it was unsafe to have sex because you have a high-risk pregnancy, have as much sex as you and your partner want.
We talk about the health benefits of sex. Are there any specific benefits for people who are pregnant with sex?
Yeah, absolutely. Having sex while pregnant has a lot of advantages, including continued intimacy with your partner. Sex might even be better than ever because you will feel an increased sensitivity due to an increase in blood flow to the vulva. You may also sleep better after having sex because you're more relaxed. The hormones like oxytocin are released during orgasm and can help make you feel less achy and calmer. Keep in mind that not having sex is also fine. Not all women experience an increase in desire. Women in their first trimester are often very tired, while women in their third trimester may be exceptionally uncomfortable or may have some insecurities. And there is some anecdotal evidence, although I'm not sure about peer-reviewed research, that shows that sex may kickstart labor in instances where the person was already overdue.
So you don't want to be in a sexual situation where you're going to kick off labor. I mean,
well, those are okay. So again, anecdotal evidence. So this is a lot of hearsay, and it's only when the person is overdue. I know that that's one of the things that people will try to do, is have more and more sex to increase or bring on the labor. Okay. I have not seen any peer-reviewed research that this works.
All right. Well, here's the $64,000 question. Will she still have orgasms when pregnant?
Well, studies indicate that it may be less likely for a woman to have an orgasm as her pregnancy progresses, but that's certainly not true of all women. Experiencing an orgasm may have more to do with how the woman feels about being pregnant and her body image, along with what positions the couple use during sex. A couple might want to try new positions that are more comfortable.
We're moving on to our seventh question of the day, Dr. Leah. A man says, my libido is very high. He's bragging. What can I do?
Everyone is different. Some people have no desire for sex and others think about it frequently. You should only be concerned if your sex drive is disrupting your life or relationships. There are different factors that play a role in how strong your libido is.
Okay. Tell us about those other factors.
Well, there are biological factors like the level of testosterone and simply overall health, right? You don't know diabetes, heart disease, anything like that. Then there are psychological factors such as stress, depression, and self-esteem, which will all affect your libido. Although for most people, it makes them want sex less. Some medications can reduce sexual urges, including corticosteroids and antidepressants, as well as medications for prostate cancer, diabetes, and blood pressure. But he would need to talk to his doctor, and I'm not a huge fan of using pharmaceuticals to decrease sex drive unless it presents a major problem in your life.
Okay, so what should he do if he is concerned?
Well, if you're unsure about the state of your libido, you may want to talk to your doctor and have a blood test to determine the levels of your sex hormones and see if there's a physical reason for that super high libido. If there are no physical reasons for your high libido, your doctor may simply suggest therapy or counseling. It can help you discover the reasons that trigger your high libido and help you learn some techniques to manage it.
Okay, what we eat and how we exercise always have something to do with sexual health. So can diet or exercise help?
There is research that suggests that dietary changes can have an effect on your libido. Eating licorice, you hear, may lower testosterone levels, but again, there really isn't enough research about its effect. There are also claims that soy lowers testosterone levels, yet I'm really not seeing that in the research either. There is an injectable leuprolide, which can be used in terms of chemical castration, although it's typically only used in sex offenders or people with prostate cancer, breast cancer, or endometriosis. And I can say firsthand that it doesn't always decrease your sex drive. So if you are in a relationship now and you're not sexually satisfied with your sex life, you can have a conversation with your partner and see if you can both agree on how to have sex more satisfying for both of you.
So communication is the key to everything when there are issues, correct, Dr. Leah?
Oh, yeah, always.
Absolutely. Our last question of the day, unfortunately. A viewer wants to know, what are some questions to ask your partner to reveal their secret turn-ons, Dr. Leah?
Well, sometimes it's tough to find out what your partner thinks is a turn on. But if you look on the internet, there are many sites that can give you some ideas. So you could simply say, like, what's your definition of amazing sex? And then you could try to have it. If you could have sex anywhere in the world, where would it be? What's one of your favorite sexual fantasies? What's a porn you're watching right now?
Okay, so what if your partner feels kind of weird hearing about that?
Well, both people just need to keep in mind that most of the time, the type of porn that we watch doesn't directly correlate to the type of sex that we want in real life, right? So you might want to ask, like, what's something that's non-sexual that turns you on? It's a little easier way to ease into there. Do you have a fetish? Is there a sexy song that gets you in the mood? That's pretty harmless, right? Have you ever been caught having sex before?
And Dr. Leah, what if you have a jealous partner?
Then I would definitely avoid any questions that reference any past sexual experiences. Just focus questions on future sexual experiences that you would want to try.
So fantasize, maybe.
Absolutely.
Future, okay, that helps. Thank you.
Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.